Immediate treatment is critical for sudden cardiac arrest victims, since survival chances decrease by about 10% with every minute without defibrillation. CardiAid Automated External Defibrillator is designed especially for public access use. It provides life-saving electroshock treatment for a patient having sudden cardiac arrest within the critical first minutes until professional care is available. Besides its successful detection and treatment algorithm, CardiAid AED is perfect for public access use because it provides comprehensive assistance to the user. CardiAid AED is designed to be easy to use and quick to treat. It guides the user with clear voice prompts, illustrations, and flashing lights. Every detail was contemplated to shorten the time before defibrillation. The voice prompts have the optimum combination of duration and content, and the supportive lights and illustrations provide much faster action for even the inexperienced user. If you see a person lying unconscious, first make sure that you, the victim, and any bystanders are safe. Check the victim for a response. Gently shake the shoulders and ask loudly, "Are you all right?" Turn the victim onto his back. Open the airway by tilting his head back and lifting his chin. Keeping the airway open, look, listen, and feel for breathing. If he does not respond, shout for help, call the emergency number 000 or ask someone else to call for you. Obtain the nearest CardiAid AED. If there is another person present, ask him to bring you the CardiAid AED and perform CPR until the CardiAid AED arrives. CardiAid AED switches on automatically when the cover of the device is opened. Follow the verbal and visual instructions.
Check for breathing. Phone emergency services. If not breathing normally, remove clothing from chest and stick on electrodes. Stick electrodes on patient's bare chest. Stick electrodes on patient's bare chest.
If necessary, use the scissors in the emergency kit with CardiAid to cut the patient's clothes. Open the electrode pack, peel off the backing, and stick each electrode on the patient's chest as per the picture on each electrode. CardiAid immediately starts analysing the heart rhythm. Do not touch the patient from now on.
Do not touch the patient from now on. Analysing heart rhythm.
If electroshock is necessary, CardiAid informs the user and prepares the shock. Make sure that the patient is not being touched or moved.
Shock necessary. Do not touch the patient from now on. Preparing shock. Do not touch the patient from now on. Shock will be delivered. Shock delivered. Patient may be touched. Carry on resuscitation. Alternately, make 30 chest compressions and give 2 mouth-to-mouth breaths.
After 30 chest compressions, give 2 mouth-to-mouth breaths. Continue CPR by following CardiAid's instructions until the instructions
"Do not touch the patient from now on"
is heard. After CPR, CardiAid will analyse the heart rhythm again and prepare a second shock if needed. Do not detach the electrodes and keep following CardiAid's instructions until professional help arrives. During operation, your AED may warn you of the following.
Movement detected.
Make sure patient is not being moved or touched. Once the patient is still, the AED will resume analysing the patient.
Plug electrodes into socket.
Electrodes are not connected to the AED.
Pediatric electrodes connected.
Pediatric electrodes should only be used for patients who weigh less than 8 kilos.
Battery low.
Battery LED is on. Battery needs to be replaced. The AED will still function but should be serviced as soon as possible.
Device is not ready for use.
Battery and fault LEDs are on. AED battery is too low for it to function correctly. Have the AED immediately returned to service centre for repair.
Device is not ready for use.
Fault LED is on. AED is faulty and should be immediately returned to the service centre for repair. To ensure your AED is always ready to use, check on a daily basis the status of the green flashing OK symbol. The flashing LED can be seen through the window in the case. If the OK LED is not flashing, the AED is in need of service. Once a month, take the AED out of its case, open it. Check the AED turns on. Check the electrodes are in place, attached, and are within their use-by date. Always store your CardiAid AED in the wall mount. The wall mount should be attached to a wall in a location that is visible and easily accessible, sheltered from the elements, safe from vandalism and theft, able to support the weight of the AED. We are here for you. Should you need assistance, our trained customer service team is here to help. They will be able to problem solve, book in service and maintenance, arrange a loan unit if required, order extra AEDs or spare parts. To contact our customer service by phone 1300 726 666, email info@lifestation.com.au, our website lifestation.net.au/support. When contacting support, please supply your serial number or stock number. These numbers can be found on the front of your AED.